Hi, my name is Richard Savel. I'm the director of the Surgical Intensive Care Unit here at Maimonides Medical Center, and we'd like to welcome you to your rotation here in the Surgical Intensive Care Unit. We're excited to be working with you, and we're excited to be sharing with you our philosophy as you join our multi-professional team for a few weeks. To do well here and to get the most out of it, you need to share our philosophy of collaboration, coordination, and communication. There will be lots of different things happening, often simultaneously, and the challenging part of this rotation is to stay focused, and I would say the most important thing is communication. Communication with the critical care attending, communication with our advanced practice practitioners, with the bedside nurses, and I would say most importantly, with our primary surgical teams. As you'll see when you're here, though all of the orders go through our team, the content of those orders is a constant, important, collaborative discussion with the primary operative team.
Hi, I'm Gerard Betro. I'm one of the surgical critical care attendings here at Maimonides Medical Center. I want to welcome you to your rotation in the Surgical ICU.
Hi, I'm Uma Idupuganti, one of the critical care attendings in SICU. Welcome to your SICU rotation, and I look forward to working with you guys.
Hi, I'm Dena Borgia, and I'm a nurse practitioner here in the SICU at Maimonides Medical Center. Welcome to your SICU rotation.
Hello. My name is Merik, Aminov. I work in the surgical step-down, and I look forward to working with you in your intensive care unit rotation.
Hi, my name is Christa Lenzi. I'm the clinical pharmacist in the surgical intensive care unit. I'll be working with you during your rotation up here. My extension is 1655, and the main pharmacy's extension is 7828. Looking forward to working with you soon.
Hello, my name is Esteen Barnes, and I am the manager here in the SICU. Welcome to your rotation here in the SICU. If there's anything that you need while you're here in the SICU, please feel free to call me at 7970, or you can page me at 0172. Thank you.
In this section, we'd like to share with you where we've kept online resources on our intranet so that you have access to them, preferably before you begin the rotation. When you come onto the Maimonides intranet, go to Departments, Surgical Critical Care. All of these are for you, and what we strongly recommend you begin with is the Surgical ICU Resident Survival Guide, which is on top, and down here, commonly used SICU drugs. Both of those are very important and will help you get through this rotation. Some of the other important things that you'll find here include our daily sedation and ventilator protocol, the ARDSNet protocol, the Surviving Sepsis Campaign guidelines. In addition, there are resources available for nutrition. This is our surgical board that we keep track of all the patients on in terms of the surgical intensive care unit. When you get called with an admission, take one of these nice magnets and put them here. These are patients. When you get told about a patient that you believe is going to be coming to the intensive care unit, put their name here and what service they're going to. Then you take two magnets of the same color and you put them here. When you are told by the nursing staff what bed they are going to, you put one of those magnets there. That means that this patient is slated to go to bed 5. When the patient actually goes into that bed, move the magnet into that space. You have moved the patient now into the bed, and you put the magnets away. If you're aware of where the patient will be leaving, if they're ready to go to a floor or a step-down bed, you just put that information right there. Thank you very much. In this part of the video, we will be sharing with you some of the pieces of equipment that you will be working with while you're here in the surgical ICU. We'd like to begin with this. You have a fully functional portable battery-operated bronchoscope. This is located in the on-call room, and here's what it looks like. This is fully functional. The battery is over here. When you use it, please make sure that it is properly returned to the anesthesia workroom where they will clean it and return it to you. Our next piece of equipment is right here. This is our EZ-IO Intraosseous vascular access device. You have it here. This will also be in the on-call room. As you can see when you open it up, it's fully prepared and ready to go. Most of you are already in-serviced on how to use this, and if you are not, please coordinate with your critical care attending so that you can become properly in-serviced. We also have a GlideScope for you with all of the appropriate equipment ready to be used at a moment's notice. This is usually kept outside of the Surgical ICU conference room, and after you use it, please make sure to coordinate with the rest of the team so that it is returned properly for cleaning and replacement in the anesthesia workroom. We also have a fully functional SonoSite M-Turbo device. It's usually charged and fully functional. We also have everything else you would need. This is obviously for use with central lines as well as for critical care ultrasonography. This is our unit's minimally invasive hemodynamic monitoring device called the Pico 2, and you can see we have it turned on here. This requires the placement of a special arterial line, and we'll show you where that's kept. I wanted to take 1 minute to go over for you some of the basic variables that will be obtained when you use this device. Some of them are standard, like cardiac index and stroke volume index, and if you don't have one of these little books when you start the rotation, please ask and we'll give you one. On page 39 is where all of these are stored here. There's a specific one to this particular device, the Global End-Diastolic Volume Index, or GEDI, and it's really a combination of right and left-sided filling pressures. In addition, there are 2 markers of whether or not the patient is still volume responsive: stroke volume variability and pulse pressure variability. If that number is greater than 13 to 15%, the patient may be volume responsive. And then finally, down at the end, you can see the extravascular lung water index, and if it's greater than 10, the patient has some significant degree of pulmonary edema.
This is the room where you'll find most of the equipment to do procedures while you're on this rotation and to be able to obtain vascular access on patients. You'll need to have access to get in. You can ask the nurses around the unit because they are typically the ones who will have access to the unit, or if I'm here, I also have access as well. Inside here, there's respiratory equipment, and there's also culture bottles if you have to do blood cultures, ABG syringes, and this is all stuff for arterial lines and alcohol swabs and ChloraPrep. Down here, you'll find sterile gloves in different sizes, and you have your ChloraPrep sticks right here. And then above this, in this area of the room, we have cortices that have double lumens, single lumen cortices. There's chest tubes, trialysis catheters. We also have Swan-Ganz catheters, trachs, central triple lumen catheters, as well as Shileys. And also we have, This is our procedure pack, and the sterile procedure pack that you use when you're placing any sort of vascular access on the patients. And there is a drape that comes with the Cook triple lumen catheters, but this is the drape in here actually covers the patient's entire body, which is the standard of practice for while you're here in the unit. Central station is where you'll be able to find the special catheters for the Pico arterial line placements, which is in this box. And this is the special tubing, but this is for the nurses to set up their part. And you'll also find an arterial line kit. We have the 3-inch, which has the yellow catheter, that's the radial. And in the cabinet over here, next to it, we have the 6-inch catheters to place arterial lines, which can be used for the femoral or axillary. These cabinets are generally locked, and you can obtain a key from either the charge nurse or, during the week, the information specialist.
Let's talk about commonly used drugs in the ICU. With regard to pressors, norepinephrine and vasopressin are commonly used. Phenylephrine less so. You can see the document for dosing specifics. For diuretic infusions, Bumex is most commonly used. With regard to sedatives and narcotics, here in the surgical ICU, the preferred approach is analgo sedation. Routinely, fentanyl is used first line, and propofol is added if further sedation is required after the pain has been controlled. This is generally speaking. Of note, dexmedetomidine should not be used without approval by a critical care attending. Similarly with neuromuscular blocking agents. Also, there's information on the sheet about antihypertensive continuous infusions. The one you'll most commonly use here is nicardipine. With respect to antibiotics, early administration of broad-spectrum antibiotics is crucial in patients with severe sepsis and septic shock. This can be done by using our sepsis ordering pathway. Further antibiotic selection should be closely coordinated with the critical care staff.
Thank you so much for watching this introductory orientation video as part of your surgical intensive care unit rotation. Again, we welcome you to the intensive care unit and hope that your stay with us is a positive, educational one. Feel free to contact any of us if you have any questions during any time that you're on the rotation with us.